Assalamu alaikum. Anatomy of the scrotum. The scrotum is a pouch-like structure located just behind the penis that contain testes, epididymis, lower part of the spermatic cord. It play a critical role in regulating the temperature of the testes for optimal spermatogenesis, sperm production. Externally, it has divided by a skin raphe. Internally, the scrotum is divided into two halves by scrotal septa. The layer of the scrotum, skin, dartos muscle, external spermatic fascia, cremasteric fascia, muscle and fascia, and internal spermatic fascia. And lastly, tunica vaginalis surround testes and epididymis. The pigmented skin is thin, pigmented and covered with hair in adult men. The dartos muscle is thin layer of smooth muscle beneath the skin that causes wrinkle of the scrotal skin. It helps regulate temperature by contracting in cold and temperature to reduce the surface area. The external spermatic fascia derived from the aponeurosis of external oblique abdominis muscle. The muscle of cremasteric muscle and fascia. This is a muscle that surrounds the testis and it's involved in temperature regulation by contracting to elevate the testis in cold weather and relaxing in warm condition. Internal spermatic fascia. It is derived from fascia transversalis. Tunica vaginalis. A serous membrane derived from the peritoneum covering the testis and epididymis. The blood supply of the scrotum. Anterior surface of the scrotum is supplied by the anterior scrotal artery, which is the branch of superficial external pudendal artery, which arises from femoral artery. Femoral artery is the continuation of external iliac artery. The posterior portion of the scrotum is supplied by the posterior scrotal artery, which is the branch of internal pudendal artery, and internal pudendal artery is the one of the branch of internal iliac artery. Another artery, cremasteric artery. This is external iliac artery. This is inferior epigastric artery. Cremasteric artery arises from inferior epigastric artery. So this is inferior epigastric artery and this is cremasteric artery, and it supply the lower it supply the spermatic cord and part of the scrotum. The venous drainage of the scrotum. The anterior scrotal vein from the anterior scrotum drain into the superficial external pudendal vein, and this vein drain into the femoral vein or Gethsemane vein. The posterior scrotal vein, this vein drain posterior scrotum and is drain blood into the internal pudendal vein. So this is the internal pudendal vein, the posterior scrotal vein, internal pudendal vein, and ultimately it drain into the internal iliac vein. So this is the posterior scrotal vein drain into the internal pudendal vein. The nerve supply of the scrotum. Anterolateral surface is supplied by the genital branch of the genitofemoral nerve, root value number 1 and 2, and anteromedial surface is supplied by the ilioinguinal nerve, root value number 1, both are the branch of the lumbar plexus. The posterior caudal branch of the perineal nerve is the branch of pudendal nerve which arises from sacral plexus. It supplies the posterolateral portion of the scrotum. The posterior medial portion of the scrotum is supplied by the perineal branch of posterior cutaneous nerve of the thigh. The scrotum is also supplied by the autonomic nerve derived from the inferior hypoglossal plexus. They regulate the contraction of the cremaster and dartos muscle for thermoregulation. One of the important reflex, the cremasteric reflex, a superficial reflex caused by the stroking of the inner thigh leading to the contraction of the cremasteric muscle which lift the testicle on the same side. The pathway sensory fiber from the genitofemoral nerve detect the stimuli and nerve fiber also from the genitofemoral nerve trigger the muscle contraction. This reflex is often used to assess the integrity of the lumbar 1 and 2 spinal cord segment and genitofemoral nut. It may be absent in conditions like testicular torsion or spinal cord injury. The applied anatomy of the scrotum. Scrotum regulate the temperature of the testis. The scrotum maintain a temperature 2 to 3 centigrade lower than the body of the body to facilitate sperm production. Cremaster and dartos muscle contraction and relax in response to temperature change to help keep the testis cool. There is a rule of temperature regulation by the pampiniform plexus actually help to lower the temperature within the scrotum. How we do this? The pampiniform plexus is a venous network. It consists veins that surround the testicular artery. Testicular artery is carry the warm blood from the body cavity and this pampiniform plexus around the testicular artery reduce the temperature because the temperature of the pampiniform plexus is 33 degrees centigrade but the temperature within the testicular artery is 39 degrees centigrade. So, during passes of the blood from the body cavity within the testis, the blood within the testicular artery is lost its temperature. The countercurrent flow, the blood flow in the opposite direction to the arterial blood exchange heat transfer. So, by this process, the temperature within the scrotum is 2 to 3 degrees lower than the body temperature, which facilitate the sperm production. The clinical anatomy, hydrocele. Hydrocele is accumulation of the fluid within the tunica vaginalis causing scrotal swelling. It is diagnosed by a test, stance illumination test, a diagnosis test used to detect fluid-filled mass such as hydrocele in the scrotum. A light source is placed against the scrotum. If the mass is fluid-filled, it will glow or transmit light, while solid masses will not. The clinical signification commonly used to differentiate between hydrocele and other scrotal conditions like hernia and tumor. In hernia and in tumor, this illumination test is negative. Varicocele. Varicocele means enlargement of the vein within the scrotum affecting the pampiniform plexus. Usually, it's seen in the left side. You see, the right testicular vein is directly open into the inferior vena cava because inferior vena cava is situated in the right side of the body and the flow it enter within the inferior vena cava by a angle by a relatively vertical and straight pathway. So there is a less blood flow resistance present in the right testicular vein. In the left side, you see the Left testicular vein is open into the left renal vein at a right angle, causing more resistance to the blood flow. The left renal vein is squeezed, sometimes squeezed between the supramesenteric artery and aorta. So pressure within the left renal vein is increased, which hamper the venous drainage of the left testis. This is also known as the Nutcracker syndrome. The Cryptorchidism. It is a clinical condition uh, where testis is failed to descend into the scrotum during fetal development. Typically, it has two phases, transabdominal phase, 10 to 15-week gestation. The testis develop near the kidney in the abdomen. The gubernaculum is a fibrous cord, help guide the descent toward the inguinal region. Inguinoscrotal phase is 25 to 35-week gestation. The testis pass through the inguinal canal into the scrotum, guided by the gubernaculum, and just before birth it reach within the scrotum. And Cryptorchidism is occur due to the failure of the gubernaculum. If it does not elongate properly, the testes do not descend. Hormonal imbalance can cause this clinical condition. Low level of testosterone can disturb the descent. Abdominal issue, problem with intra-abdominal pressure or peritoneal cavity may hinder descent. The pathological effect, it causes infertility and increase the risk of cancer if left is untreated. So this is all about anatomy of the scrotum. If you find this video helpful, please share this video and please follow me in YouTube, my YouTube channel Easy Human Anatomy, and my Facebook page Easy Human Anatomy. Thank you for watching.